I'm very glad to be able to speak to you on the maternal health of refugee and migrant women subject. And I am sorry I could not be with you in person today. The Women in Parliament's Global Forum on this subject in Malta in March placed the issue firmly on the agenda. And I'm proud to be part of the Women in Parliament's Global Forum, an incredibly important network fighting for gender equality worldwide, as the Global Forum showed. When so many vulnerable women are in such urgent need, it is heartening to hear the Commission and the Council of Ministers making clear and firm commitments. As you may already know, the European Parliament adopted the Honeyball report on women refugees and asylum seekers way back in February 2016. That report called for a holistic and comprehensive approach to the needs and to the risks for refugee women. It called for capacity building among the staff that come into contact with them, be they border or immigration officials, police personnel, doctors or social workers. And it highlighted the risks of maternal deaths among refugees. We certainly need to do more to raise the situation of women refugees higher up on the agenda. However, words alone are not enough. While grand political commitments and well-drafted policies on glossy paper are important, what we need is simple to say, but harder to do. We must implement. We need member state governments to live up to their commitments on the ground, away from the conference halls and press conferences. We need the funds to reach those who need them most. We need doctors to have the capacity to provide the care for pregnant women in makeshift camps in border areas or in reception centres. We need to train border guards and immigration officials who are already working long shifts stretched beyond their means. We need to invest more in tackling the interlinked networks that put vulnerable women at risk, such as the smugglers and traffickers. When babies are born, we need to make sure they too are cared for and that children have access to education where they are. The outcomes of the Women in Parliament Forum provide the thought through holistic and interconnected policies which are needed to bring all these crucial actions together. However, we need the real political impetus to act with a view to truly transforming the lives of the women out there, walking in the hills of the Western Balkans or in the camps of Greece or Italy, or those who have arrived in reception centres in Germany, Sweden or the Netherlands, women who I have met. I speak to you not just as a politician, but as an activist. And each one of us, no matter our position, has the ability to raise our voice and stand up for what is right. Political leaders in each member state must feel that political pressure to act and take the responsibility to bring about that action to save lives. And that belongs to each and every one of us. Thank you for all your work and your commitment. Have a good conference.